Amish, Eric Ting of SF Gate out in San Francisco writes up how California mask mandates are now going to go county by county. Should we expect that nationwide, that there will be a city by city, county by county, block by block debate about indoor mask protocol?
I do think it's going to move from the state governor's mansions to each individual county or municipality making that decision on their own. And I think that's better than what we have now, because it's not one size fits all, and it might reflect the transmission that's going on in a given area. But eventually what you're going to see is masking become something that is an individual risk calculation. Some people will continue to wear masks, especially those who are immunosuppressed and are at high risk, and others will get rid of their mask. And it's also important to remember that one-way masking works. So if you're somebody who's very worried about getting COVID-19, maybe because you've had a kidney transplant, you can wear a mask one way, and it's going to provide benefit. But that's where we're going. I don't think that you're going to see many of these mask mandates at the state level stand for much long. And indeed, many states, including my own in Pennsylvania, have not had a mask mandate for months and months.
What is the science of masks? I've had this asked of me at least 3 times in the last 24 hours. If you're in a classroom, and you're definitive on this in Pittsburgh, if you're in a classroom with a bunch of interns and they say, what's the actual science of wearing a mask? What is it?
So the science is that properly fitting masks that are either surgical or procedure masks or N95 equivalents do provide 2 benefits. One is they provide source control. So if someone is infected with the virus, it's going to block some of that transmission from that person. And the wearer is going to get protection because those particles are not going to be able to penetrate those masks. And that most of that data is on medical grade masks, and most of that data is in adults that are wearing well-fitting masks. It becomes a little bit more fraught when you try to actually extrapolate that to real-world use, because people don't necessarily wear masks the way they do in clinical trials. But there is data from the early days of the pandemic that places that did have high mask wearing did see cases fall, controlled for everything else. So there is data that it works, but they only work as well as you actually wear them. And you have to think about the context, what the marginal benefit is. Like, for example, wearing a mask outdoors is probably not going to have any benefit at all, because the risk of transmission is already so low that you can't really get it much lower. Yeah. But they clearly work. But it's all about trading off the benefits of the mask versus the discomfort people have and how dangerous COVID-19 is.
Dr. Adalja, we're here talking about masks and mask mandates being lifted in the Western world. And even COVID-0 areas like Singapore and Australia have thrown in their towel and basically said, look, we can't pursue that strategy. We have to open up and just deal with a certain level of viruses. At the same time, Hong Kong is actually imposing even harsher curbs to try to stave off the infections that are actually spreading. Have we already seen this fail? Is this basically in real time the zero COVID policy in Hong Kong, in Beijing, failing?
Yeah, yes, and it was destined to fail because it's not an actual policy that's based on reality or based on the science of the virus. It's biologically implausible to eradicate or eliminate efficiently spreading respiratory virus that has an animal host. So COVID-0 was wrong from the beginning. If someone wrote that on an essay question on a test, I would say that's a wrong answer to how you deal with this type of a virus. And I wouldn't say that Australia and New Zealand threw in the towel. They shouldn't have even been holding any towel. They should not have even pursued that from the beginning because it was futile. I think what we have to come up with in these countries is a sustainable approach that knows that you're going to have COVID-19, but it's going to be milder because your population is vaccinated and you have monoclonal antibodies and Paxlovid, and you teach the population what activities are risky or not risky. But China hasn't done that. And I think it's not surprising that an authoritarian country like China is the only one that's really still holding on to COVID-0. But what they're doing is just inevitably pushing off something that could be a disaster because they may not have enough immunity in their population because their vaccine may not be the best. They may not have had enough vaccine uptake, and they have no population immunity. So that's a really dangerous situation that China has created, basically kindling for COVID to really hit their country hard because they've been kind of postponing the inevitable and not actually taking the necessary steps to come up with a sustainable approach that reflects the biology of the virus.
Dr. Adalja, explain what the consequences of that are, because that's a very significant statement, this idea that you could be setting the petri dish for a mass uprise in the number of cases of COVID if they do open up their borders and they do have zero immunity or near zero immunity. What does that look like for the rest of the world?
from the rest of the world, as long as the world is vaccinated, it's not going to look bad from a health standpoint, but it's going to be much more disruption because China is a major trading partner, so supply chains, all of that will really be impacted if China is getting hit hard with COVID-19. People always talk about natural immunity in a negative term, but the fact is the level of immunity in a population is important, whether it's vaccine-induced or whether it's coming from vaccines, when it comes to how resilient your population is going to be, how much serious illness is going to occur. And because they have such low levels of immunity in the population, when you start seeing spread, inevitably, when they start to back off of those policies, if they don't have people vaccinated, you're going to see a lot of people get infected, and a lot of people need hospitalization, and it's going to be very disruptive. And I think it will be something where people can look back and say, this is the result of what your policy was for so long, and that COVID-0 is actually put your population at higher risk, even though you might have been bragging and touting about the low number of deaths. It actually wasn't going to be that way forever.